Hi parents, if you're watching this video, you're probably staring at your baby's scalp right now, wondering what those crusty yellow patches are and why they won't go away. Maybe you've tried everything, but I want you to take a deep breath because what I'm about to share will help you understand what's happening and, more importantly, how to fix it. Let's get into it. Hi, I'm Jen. I'm a nurse practitioner in IBCLC, and I'm here to help you along on your parenting journey. And what you're seeing right now is what I call cradle crap. It's cradle cap, and it appears as thick, yellow, crusty, brownish scales on your baby's scalp. The scales can be greasy, they could be dry. The skin underneath might look a little bit red. Sometimes you'll see it even extend into the eyebrows, behind the ears, in the creases of the neck, the armpit, and the diaper area. It's kind of gross. They can range from small flakes to thick, huge crusts, and it can almost seem impossible to remove. So cradle cap typically appears in the first few months of life, often between 2 weeks and 3 months. It's actually quite common to see it after or alongside baby acne if your baby had one of those breakouts. Most cases resolve on their own between 6 and 12 months, but some babies can have it persist even into toddlerhood, or occasional flare-ups will occur sporadically. The key here is stubborn. This condition doesn't disappear overnight, but it does get better eventually. The excess oil causes skin cells to stick together instead of shedding normally, and that's what causes those crusty little patches. Now, cradle cap is not caused by poor hygiene. It's not an infection, it's not contagious, and it's not an allergic reaction. You didn't do anything wrong. This isn't about how often you bathe your baby or what products you use. This is just your baby's skin doing its thing while adjusting to life outside the womb. Okay, so what about hair loss? Some parents come into my office really nervous and freaking out about losing your baby's hair. And I understand why. When the scales come off, you can see the hair attached to them. Sometimes it leaves bald patches behind. Sometimes it looks like your baby is losing more hair than they're growing. So I know it can be scary. Here's the reassuring truth. Cradle cap does not cause permanent hair loss. Let me say that again. It does not cause permanent hair loss. It does not damage the hair follicles. The hair that comes off is simply caught in the scales as they shed. Think of it like hair getting stuck in a scab. It doesn't affect the actual hair follicle beneath. It's perfectly healthy. So if your baby's hair is coming off with those scales, take a deep breath. It's fine. The hair will grow back. Some babies naturally have temporary hair loss in their first year anyway, as their baby hair transitions into more permanent hair, and the bald patches you're seeing will fill back in, I promise. I've seen hundreds of babies go through this, and every single one has grown back into having beautiful, healthy hair. Now, how do we treat cradle cap? Cradle cap is stubborn, but with gentle, consistent care, you can manage it and get through it. Here's what I tell my patients every day in my office. Gentle shampoo daily. Washing your baby's scalp daily or every other day with a mild shampoo can help loosen those scales and reduce oil buildup. Gently massage the scales with your fingertips, not your fingernails, and don't be afraid to really work up a lather to get that off. If that's not enough and you have those stubborn patches, use some oil. You could use olive oil, avocado oil, coconut oil, baby oil. It doesn't matter. You want something that's very sensitive and non-cosmetic. You'd want to something that you'd ingest, basically. Massage a little bit of that oil into those scales about 15 to 30 minutes before bath time when you're planning on washing the baby's scales off anyway. This oil helps to loosen those scales and makes it easier to come off. So apply that oil, let it relax in there for 15 to 30 minutes, and then get one of those little tiny soft bristle baby brushes. You can gently scrub your baby's scalp, and to loosen those scales, that will help. Then use the baby shampoo. You want to rinse it completely. Make sure you rinse out all the oil and the shampoo from your baby's scalp, because leftover residue can make it worse. For really stubborn cases, if that's not enough, I will recommend using one of those dandruff shampoos for adults once, maybe twice a week, depending on the severity of the case. But that being said, you want to make sure you are protecting your baby's eyes. And I know it says the bottle is not made for babies, and it's not. So I want you to make sure that you're using it under direction of your healthcare provider. and only use a small amount, massage it in gently, let it sit for a few minutes, then rinse it out really well. On the other days when you're not using that shampoo, go back to your regular baby shampoo. The next step is having patience because this is not an overnight fix. You might need to repeat this routine for several weeks, and some scales will come off easily and others will need multiple treatments. So it's progress, not perfection, and don't get frustrated. What you don't want to do is you do not want to pick those scales. Don't pick them, don't scratch them. That can cause bleeding, leads to more infections. Don't overdo the dandruff shampoo. 2 times a week max. We don't want to dry out your baby's skin. Don't overwash your baby's scalp. So once a day is perfect. You don't want to do any more than that. And don't worry about the soft spot so much. That little fontanelle that's at the top of your baby's scalp is pretty strong. You can gently wash and brush it all you want. It's tougher than you think. When do you want to call your healthcare provider? Most cradle cap can be managed at home, but if you notice anything changing or getting worse, scales that are spreading beyond the scalp and getting consistently worse in places that you're not sure it should belong, skin that looks inflamed, very red, swollen, oozing, bleeding, yucky infection signs, if your baby seems really uncomfortable or is scratching excessively or appears bothered by it. If the cradle cap isn't improving after several weeks of home treatment, call your provider. If your baby's having significant hair loss that seems unusual or concerning to you, then reach out. It's better to have that peace of mind. We may recommend something prescription strength if needed, or a cream that needs to go on this by prescription only. So let us know if anything's not going in the right direction. Remember that cradle cap looks much worse than it feels to your baby. Most babies are completely unbothered by it, and it's more of a cosmetic concern. It's not necessarily a medical problem, and it will resolve over time. The hair loss you're seeing is totally temporary, and your baby is healthy, beautiful, and those crusty little patches are just a normal temporary part of infancy. Be patient with the process, be gentle with your baby's scalp, and be kind to yourself. You're doing a great job navigating all these little surprises that come with a new baby. And as always, if you have any concerns or questions, leave a comment, and I'll see you on the next one.